VA ratings for insomnia, and I just wanted to kind of preface it with a few things. From a rating perspective, this is about Veterans Benefits Administration benefits. You have to have a strategy, come up with a plan, get my boot camp. If you need medical evidence, there's a link in the description for that too. Typically, it's a mental health symptom and a pretty low one, and that's kind of what we're going to talk about. What do you know about insomnia? What can you tell us?
Insomnia actually is the number one sleep disorder, believe it or not. Insomnia is either the inability to fall asleep or the inability to maintain your sleep, or you can have both. So you can have a hard time falling asleep. You can wake up in the middle of the night and you can't get back to sleep. But usually there's some underlying cause to your insomnia. And the idea would be to figure out what it is. It could be very short term or it could be very chronic and long term. And we talk about the VA ratings as far as insomnia goes. Sometimes there's a mental health component to it. And, really getting to the crux of what or when it possibly even started. Because something must have started the insomnia to happen. Is there, I always say to patients, is there a sickness in the family? Did you lose a loved one? Are you stressed about school? There's something that has caused it. So when you're talking about insomnia symptoms, again, you want to go back to what is the underlying cause. And for the VA and the ratings, this is a conversation, again, you want to have with your provider and really have a conversation. It's not just, hey, I have insomnia and I can't sleep, give me something to fix it. Let's figure out where the underlying cause is. So do you have depression? Are is this stuff that's interfering with your daily routine? The thing is with mental health and insomnia is they're bidirectional. Your insomnia can make your mental health worse. Mental health issues can cause your insomnia to be worse. So the idea would be to really have that conversation, honest conversation with your provider about what is really going on. Over time, insomnia is really going to cause more, problems with your everyday, dealing with your everyday life, because we all know that whatever's not going well with when you're sleeping, and we're going to talk about sleep apnea later. Anything that's not going well with while you're sleeping is going to affect your overall health during your waking time in your life.
VA claims are all about strategy. I preach and I teach strategy in my boot camp. Check it out at combatcraig.com. Yeah, that makes sense. And insomnia is something just in my own experience. Like, oh, I have insomnia. I've had it for a long time. Like, oh, I have insomnia. I didn't sleep or I don't sleep or you can't self-diagnose yourself with anything, but that's such a common term that people understand what you're talking about. And whatever, I didn't sleep, I have insomnia. Oh, me too. Again, don't do that when you're trying to file a claim. Get a doctor to do it. But then you look at a word like I'm feeling depressed. That's different. Like feeling depressed. So are you sad? Are you diagnosed with major depressive disorder? So a little bit different with insomnia, depression, I'm feeling like I'm stressed or anxiety. All these things feed into it, and make sure you figure out what it is. And for VA rating purposes, we're going to talk about the criteria in the 70% mental health category. And I'll show you why insomnia alone usually ends up at 30. Not saying that people don't get higher ratings. It's just typically you get 30 because you don't have the symptoms. It comes down to social and occupational impairment. Major depressive disorder fits in there a lot better, or PTSD or anxiety or one of the other 150 conditions other than insomnia.
Are there any obsessive, things that you're doing that are interfering with
daily activities, obsessive rituals,
activities?
Checking the locks, checking the cameras too
Washing
much.
your hands.
Yep. So for me, those things are kind of in both the anxiety and the depression, my hypervigilance stuff. And, I definitely wouldn't attribute that to insomnia. It could be a little bit there, but for sure, I know, I don't know how it goes there, but I understand, and I'm diagnosed with other mental health conditions and they fit in better there.
That other one that I know is on the list is about thinking illogically, having different things going on with your speech. Maybe you're not getting all your words out like you're supposed to. And that insomnia, if you experience insomnia night after night after night, how much sleep are you actually getting? And it is going to impair your thoughts, and it's going to impair a lot of what's going on, during the day. How are you going to function? We all know when we don't get a good night of sleep and we're at work during the day, we have a hard time focusing just sitting at our desk. So if you're somebody who, like, again, has insomnia and you're only getting 3 to 4 hours of sleep, maybe some people aren't sleeping, what is that doing to your overall, you know, thoughts, activities? Are you more irritable? We know we're super irritable. Is it going to cause more of an impulse um, mechanism to have a reaction that might not be a very good one?
It's kind of funny. You're kind of selling me on that because it's like, yeah, I totally have uncontrollable road rage. The best solution isn't what I do, which is don't drive and try to avoid people. But insomnia could cause that. It could cause a lot
Sure,
of
it
these
can.
things. Yeah, yeah, you're right. It does tie in, which I guess to the bigger picture, especially coming down to ratings. There's probably other stuff going on. So go see a board certified psychologist or psychiatrist, but probably a psychologist, and get a diagnosis, find out what's going on.
It might even be your best friend or your partner who I know one of the things on the list is, you're not taking really good care of yourself. Your hygiene starts to wane. You're not getting out of bed. You're staying in bed all day long. You're not the person who's getting up to brush their hair or to put on your clothes even. There's some people who will lay around in bed all day, sleep all day. That's a good sign that, there's a depression underlying cause leading to that insomnia. You're not sleeping all night long, so we're just going to lay in bed all day long and not care about ourselves.